Hello, everyone. We're really happy and excited to welcome Dr. Deepshikha, who has been one of our very, very bright students, one of the most enthusiastic students in DocTutorials, who has been there always aiming towards pediatric surgery for a long period of time. She has been in touch with our unit with lots of doubts, and she's been there all around us. So we just wanted to make sure that she's into our field, and we are extremely happy and proud that she has finally made it to one of the most elite institutes of pediatric surgery with an rank of 8, and we are extremely happy and proud of you, Dr. Deepshikha. You can just tell your views about Dr. Rules and your way into pediatric surgery. Introduce yourself with your undergraduation, post-graduation, and your way forward.
Thank you, sir. I am Dr. Deepshikha. I hail from Guwahati, Assam, and I passed my MBBS from Assam Medical College, Dibrugarh, which is a small city here in Assam. After that, I passed my MS General Surgery from that college itself, Assam Medical College, in the year 2022. From 2022, I joined DocTutorials, and I am preparing from then. And till now, I have appeared total 4 times in INISS, and I have cracked twice in INISS, including this time. And sir, from 2022, I always feel like I dreamed of dreamed of having a seat in MCH in a central institute, and I always opted for pediatric surgeries from the time I was doing my post graduation there, and means my motivation towards the subject started from the second year PGT itself when I was in second year, and I actually published paper in pediatric surgery, poster in pediatric surgery, and I won prizes also in paper and poster both in ASICON and in Assam chapter also. And then I gradually developed interest in that subject. Then after that, I thought the preparation of INISS to a specific subject is not like NEET SS. It's like how you know the subject in depth, and how you know the theory part as well as the practical part. So theory part, so everyone can sit and come back home and sit and study in at home, but it's very difficult to grab the practical part. It's very difficult when you do not know the cases and do not know the live surgery part. Then you could not assess that, could not visualize the real diseases. So I thought to join the Department of Pediatric Surgery here in Guwahati itself, in Guwahati Medical College, as a registrar. So after that, from 2023 till now, I am joining here as a registrar in pediatric surgery, and I learned a lot of cases. And whatever I read, I see those cases, and I develop interest gradually. And I thought to accustamize myself with the subject itself first, because before taking a subject, you have to taste yourself. Okay, you will be adjusted to the subject or not. How you will be staying with that subject for the whole life. Actually, it's like choosing a wife or choosing a husband only. Choosing the subject of MCH, it's very difficult. It's not like what I dreamed in PG. It's not so practical. Okay, I will be dreaming of that or I will be staying with that subject the next 5 to 10 years. So I thought to customize myself. Then first 1 year I was very much doubtful. Okay, I will be continuing this subject or not. But in this scenario, my husband always supported me and told ki this subject always needs patience. When handling with children, when handling with their parents, how you counsel the parents, how you tackle the children is very much difficult. And the first counsel from the beginning, the counseling of the disease, and to after you explain the prognosis for the long time period of the patient, it's very difficult. So the joining the pediatric surgery department was a very good plus point in my preparation. Then doctorals itself was a very strong point because I during my duty here I get very much less time for study, but for reading Sabiston, reading daily line by line, revising each and every word is very difficult for me, and without revising the topics are very much volatile. But doctorals give us such a such a platform we cover the whole subject, whole topic, in a 2 hour video or 3 hour video. And I used to see all the videos in 2x, 1x, 1.5x, whatever I could. Means I have completed all the videos of doctorals, and your lecture was like means you means sir, your lecture is like I get to study the whole pediatric surgery book. I think whole Koran is in your lecture. Means I am very much enthusiastic. I hear your same lecture. I hear every day, like every day, because that lecture is so much high yielding. When you talk about that from symptom to symptomatology to differential diagnosis to management of different cases, and chapter wise you cover everything. So it helped me a lot, your lectures. And I also thank all the faculties of doctoral. Other subjects also I have covered in a very short time. I have covered the videos, and without that I could not also answer the general surgery topics, other than the pediatric surgery topics. And I also attended the Chennai face-to-face class in December 2023. There I have personally met you also. I don't know how you remember it or not now. I have met you, and again that day also I was in doubt. Then I thought I will again ask sir how to study and how to tackle with this subject. Then again you motivated me, and anything. I mean, thank you, because means whatever be your duty or whatever you are busy, whenever you are busy, you always have taken time to reply my doubts, whatever it will be in 5 a.m. in the morning or what in the 11 p.m. in the night. You have always answered my doubts. So I am ever grateful to you for this. And during my preparation I also want to say the phase 1 part of INISS is like whatever you know the subject clinical things you can answer. And general surgery topics are like 30 questions, and pediatric surgery are 50 questions. This time it was very much clear cut. 50 questions was totally of pediatric surgery, and 30 question was from general surgery. So you can manage. If you know the core of the subject, you can easily answer the straightforward questions only. You can easily answer the questions from the no day-to-day topics only, day-to-day diseases only, whatever we deal with every day. Pediatric surgery, all the topics were questions were from that only. You can easily answer. And general surgery topics also, if you have the in-depth knowledge of Bailey and Sabiston, you can answer the questions, 30 questions. But in the interview part, we were just asked about statistics and thesis, about the thesis. So I would like to tell the future aspirants. So if you have cracked the phase 1, then for phase 2 you should know your thesis in depth, and the biostats part in depth. They usually test that part. And they clinical cases in pediatric surgery, they just ask simple questions only, just how to deal with Hirschsprung's disease, how you prepare the night before Hirschsprung's surgery, how you counsel the parents, how you counsel the diseases to the parents. Like that only they have asked me. And thesis, they have asked me deeply how I have means taken the sample size, what was my methodology. They have asked me in depth. And last year also I cracked this INISS April 2024, rank 13 I was there. But due to some problems like my homely problems, I could not join there. Actually my mother expired in November 2024, so I could not take admission last year. So I again waited for 1 year, and again I have uh, gone around this whole process of first exam, then counseling, and then allotment again. And now I am here with a better rank than last year's rank. So I am very thankful to DocTutorial and especially you, sir.
It has been such an inspiring story, Dr. Deepshikha, from such a small town with a family. I know you have a family, your husband has been
Yes,
so
sir.
supportive, and with your
Yes,
mother's loss, I know what you've been going through personally, but all of this with such a good rank. And pediatric surgery is indeed blessed to have such a great pediatric surgeon in the making, and we are
yes, sir.
extremely happy and proud as always. And
Yes, sir.
as I tell all my students, though they were students, you'll be colleagues in 3 years' time, and then lifelong we're going to be good colleagues, and we'll always be there supporting each other, and we'll see you reach the greatest of heights in pediatric surgery, and we'll
Thank you
be
so much.
such proud friends around you. And we are thank you so much for your
Thank you, sir.
entire story, and it'll be such an inspiration for lots and lots of students who are going to take up pediatric surgery. All the best, Deepshika, and we'll always
Thank
stay
you,
in
sir.
touch with tutorials.
Thank you,
All the
sir.
best.
Keep inspiring us. Thank you, sir.
Sure. Thank you so much. Thank you.
Thank you, sir.